Dr. N'Dandu, maybe you can explain a little bit about your practice in New Orleans and some of the challenges that these patients face on a day-to-day basis.
Well, thank you so much for having me. This is a fantastic opportunity to talk about some of the challenges we're facing with critical limb ischemia, especially with our patients when they get to a point where they don't have any options from a standard revascularization standpoint, whether it's surgical or endovascular. I'm an interventional cardiologist. I'm here in New Orleans, part of the Oschner clinic health system. My practice has evolved over the past couple of years where I'm practicing perhaps 60% of my practice is critical ischemia, and the remaining is general cardiology and interventional cardiology. The challenge that we're facing is, unfortunately, then a lot of these patients that come to us sometime very late, and it's very difficult because the demand ischemia that they have requires some heavy-duty revascularization, unlike if we meet them early in the process. And then the other thing is end-stage diabetes, unfortunately, is contributing significantly to this population where close to 10, perhaps even 20% of our CLI patients are labeled as no options, where we cannot offer them what we offer traditionally, and these folks are facing amputations. And so hopefully what we are doing right now in collaboration with multiple specialties, multiple colleagues around the world, we can find a way to help these folks so they don't have to go through the challenges of an amputation, which is associated with very high mortality and morbidity.
Absolutely, and you spoke a little bit about patients coming too late. I mean, what are some of the barriers for your patients, the patients in your community, to getting diagnosed, for example, with peripheral artery disease and critical limb ischemia today?
Thank you so much. It's a great question. So I think the initial part really is education within the medical community. There are a lot of healthcare providers who don't know much about peripheral arterial disease. They're not screening their patients early, and then not treating them aggressively to prevent them, to make it, even though patients with PAD, with CLI, are only 1% to 2% of that population, but when they get to that point, we know their mortality and morbidity is very high. So I think early screening, then diagnosing and treating them aggressively. And when patients present with wounds, I think we need to be very, very aggressive on how we treat them. So we need to initiate the treatment early on with vascular evaluation, infectious disease, endocrinology, all those things, and revascularize them as quickly as possible. And for those patients that we cannot, we don't need to wait until they progress to a point of no return. We need to offer them options early on.